Arthritis: How to Protect Your Joints and Stay Active for Life. Welcome to the Senior Health Series, where we share practical, science-based guidance to help older adults live longer, stronger, and more comfortable lives. Today's topic is one that affects millions of seniors every day: arthritis. Joint pain is often dismissed as just part of aging, but arthritis is not simply wear and tear. It is a medical condition involving inflammation, cartilage breakdown, and changes in bone and soft tissue that can limit mobility and independence. In this episode, you will learn what arthritis truly is, why it develops, how to recognize early symptoms, the daily habits that reduce pain, the foods that calm inflammation, and the exercises that protect your joints for years to come. Arthritis is not a single disease. The two most common types are osteoarthritis, caused largely by cartilage degeneration, and rheumatoid arthritis, an autoimmune condition where the body attacks its own joint lining. Other forms include gout, psoriatic arthritis, and ankylosing spondylitis. Regardless of type, the end result is similar pain: swelling, stiffness, and reduced range of motion. Understanding which type you have matters because treatment strategies differ. One reason arthritis is underestimated is that it often begins quietly. Early signs include stiffness in the morning, discomfort when standing up or walking, swelling around joints, limited movement, and a cracking or grinding sensation. Many people adapt by moving less. Unfortunately, inactivity weakens muscles, reduces lubrication in the joint, and speeds up degeneration. Pain leads to less movement leads to more pain. Breaking this cycle is essential. Why does arthritis occur more often with age? Over time, joint cartilage loses water content and elasticity. Muscles weaken, posture changes, and small injuries accumulate. In inflammatory types of arthritis, immune system imbalance increases with age, allowing persistent inflammation to damage joints. Excess body weight places additional mechanical load on knees and hips. Every extra pound adds about 4 pounds of pressure to the knee joint during walking. Poor sleep, long-term stress, smoking, and metabolic conditions such as diabetes all worsen inflammation. The encouraging truth is that while arthritis cannot always be cured, it can be controlled. The goal is to reduce inflammation, maintain cartilage health, protect the joint structure, and restore movement. Let's begin with daily protection strategies. First, weight management. Even modest weight reduction significantly lowers knee pain and slows joint damage. Second, posture and footwear. Supportive shoes, shock-absorbing soles, and proper alignment reduce stress on hips and knees. Third, heat and cold. Heat relaxes tight muscles before activity, while cold reduces swelling after use. Fourth, joint protection. Use larger joints rather than smaller ones. When lifting, avoid prolonged gripping and take frequent movement breaks. Medication may be part of treatment but should be used wisely. Over-the-counter anti-inflammatory drugs can reduce pain, but long-term use should be monitored by a physician. In rheumatoid arthritis, disease-modifying medications may slow immune-driven damage. Supplements such as glucosamine, chondroitin, omega-3s, turmeric, and vitamin D are commonly discussed. Evidence varies. Omega-3s and vitamin D are supported for inflammation and bone health. Turmeric may reduce inflammatory signaling. Glucosamine and chondroitin have mixed results and work better for some than others. Always consult your healthcare provider. Now let's turn to one of the most powerful tools for joint health: nutrition. Arthritis is deeply influenced by inflammation, and diet can either fuel it or calm it. Your goal is an anti-inflammatory eating pattern. Emphasize colorful vegetables, fruits, healthy fats, and lean proteins. Foods that help your joints include fatty fish salmon, sardines for omega-3s, extra virgin olive oil for anti-inflammatory polyphenols, berries and cherries for antioxidants, leafy greens for vitamin K and magnesium, nuts and seeds for healthy fats, beans and legumes for plant protein and fiber, ginger and turmeric to lower inflammatory markers, green tea for catechins that protect cartilage. Foods that worsen arthritis include sugary drinks and desserts that raise inflammatory hormones, white bread and refined carbohydrates, trans fats and deep-fried foods, processed meats high in nitrates, excessive alcohol, high-salt convenience foods that promote swelling. Hydration matters too. Cartilage is largely water. Even mild dehydration increases stiffness. Aim for consistent water intake throughout the day. Next, movement. Exercise is medicine for joints. It lubricates cartilage, strengthens muscles that protect the joint, improves balance, and reduces pain sensitivity. Many fear movement will increase pain, but the opposite is true when exercise is done wisely. Start with aerobic activity, walking, swimming, water aerobics, or cycling. These increase circulation without pounding joints. Aim for 20-30 minutes most days. Add strength training 2 to 3 times per week. Strong muscles offload joints. Focus on thighs, hips, glutes, core, shoulders, and back. Include flexibility work, daily gentle stretching, yoga, or Tai Chi. These improve range of motion and reduce fall risk. Do balance training, single leg stands, heel to toe. Walking or Tai Chi to stabilize joints and prevent injuries. Here are several joint-safe exercises you can begin with. Chair squats to strengthen thighs. Wall push-ups for shoulders and arms. Seated leg raises for knees. Hip bridges for glutes and spine support. Ankle circles for circulation. Hand open close exercises for finger joints. Listen to your body. Mild discomfort during movement is normal, sharp pain is not. Warm up first, cool down after, and increase intensity slowly. Pain also has a neurological component. Chronic pain sensitizes the nervous system. Techniques such as deep breathing, relaxation training, prayer, or meditation reduce stress hormones and lower the brain's pain response. Try slow breathing, inhale 4 seconds, hold 4, exhale 6, repeat for 5 minutes. For people already living with arthritis, daily routines make a difference. Use jar openers and adaptive tools. Arrange your home to minimize bending or gripping. Choose activities that combine movement and enjoyment, gardening, light dancing, swimming, or walking with friends. Social movement improves adherence and mood. Let's address a common myth. If my joints hurt, I should rest. Total rest worsens arthritis. Smart rest alternates with movement. Another myth: surgery is inevitable. Many control symptoms for decades without surgery through weight management, exercise, and nutrition. Before we close, reflect on this truth: your joints are your freedom. They carry you through daily life. Hold your children's hands and allow you to enjoy the world. Protecting them is an act of self-respect. Here is your challenge. Eat one anti-inflammatory food today. Walk or move for 15-30 minutes. Stretch gently before bed. Hydrate consistently. Reduce one inflammatory food this week. Arthritis does not define you. With knowledge, action, and consistency, you can regain comfort and confidence. Thank you for watching the Senior Health Series. If this helped you, share it with someone who needs encouragement. Subscribe for our next episode, where we explore digestive health and how to heal the gut naturally. Take care of your joints. You deserve a life in motion.